My name's Ryan. I'm a patient of Dr. Kaufman. I underwent right phrenic nerve repair with Dr. Kaufman in August of 2023. It all kind of started, I had some shoulder issues when I was in the military and ended up having a surgery. And during the surgery, one of the anesthesiologists, who was a good friend of mine, gave an inner scaling block and unfortunately likely damaged my phrenic nerve. Initially didn't really notice issues while I was recovering from my shoulder surgery, but as I started physical therapy and was cleared to resume military activities and running, just really noticed significant changes in my exercise tolerance. I went from running 5-10 miles easily a day to after about a quarter mile, I'd be so short of breath, I would almost pass out. Even in physical therapy, certain exercises, bending down to tie my shoes, carrying my children up to bed to put them to sleep, I just wasn't able to do anymore. Initially, I thought maybe I had a respiratory infection, or just with recovering from my shoulder surgery, maybe I had lost some of my exercise tolerance, but it just didn't seem to get better. So I talked to my primary care and they thought maybe I developed asthma, inhalers weren't helping, thought maybe I had allergies, so sent me to an allergist, and he actually did a chest x-ray, called me in a panic and said, well, something's wrong, your diaphragm's really elevated. And that kind of started the process for me of looking into what happened. So when this occurred, I was active duty in the military. I was currently living in Virginia. What I found is, again, this is not a very common thing in medicine. Sometimes you have to really advocate for yourself. So I kind of had to look at Dr. Kaufman's publications and tell my primary care what tests I needed ordered. And I saw a pulmonologist and was kind of disappointed. They told me, well, this should go away, give it a couple years. It shouldn't be causing as much issues. Like, I would expect you to be breathing much better just with a paralyzed diaphragm. And they made me get a chest CT and again, just said, don't do anything about it. And that wasn't a good option for me. So again, really, you have to advocate for yourself. And again, that's the reason why I'm doing this, is because even in healthcare itself, not many people, I think, know what Dr. Kaufman can do and how great of an option this is for a lot of people. So I did see a physical therapist. I will say it's probably not the type of physical therapist that Dr. Kaufman would prefer. There's definitely some physical therapists that specialize in this area, but we contacted the physical therapist in New Jersey, and they helped kind of create a program and worked, I think it was about once a week for about 2 months. Initially I didn't really notice much change. And again, I don't think that's unexpected. Nerve regeneration typically takes several months. And then once I started, I would say I didn't notice anything at first, but my wife started pointing things out around 6 months, started to be able to climb up a flight of stairs and wasn't as out of breath. And before the repair, my son was right around 5 and we were trying to teach him how to ride a bike. And I struggled just trying to teach him, and could easily kind of play with the kids and do simple things like that. And kind of slowly but surely things continued to get better and wasn't getting as out of breath, doing just normal activities. Yeah, Dr. Kaufman, a world-class surgeon. As a surgeon myself, I had absolutely no hesitations from the moment I met him. All the staff I met in the hospital, from check-in to surgery, had nothing but great things to say. All the nurse practitioners and PAs and everyone I encountered were just fantastic. They were always available if I had any questions to reach out and make sure that I was recovering well, and were checking in on me. And again, just absolutely just a wonderful experience all around.